I'm Paige Onweller. I'm a professional cyclist and a certified physician assistant. My channel is getting a little revamp, and going forward, I am here to bridge sport and science with honest and comprehensive education for every athlete. The information I share here is for general education only. It's not medical advice, and I'm not your clinician. If you have concerns about your health, it's always best to talk to your own medical provider. For those of you who have been a supporter of my channel previously, thank you and welcome back. I've been racing gravel full-time for the last 3 years, and prior to this, I worked in the urgent care and emergency room for 8 years back in Michigan. I love racing bikes full-time, but when injuries occur, it can actually be really stressful. Racing bikes is how I earn my living currently, and after being involved in a horrific crash from a driver on the wrong side of the road, it's been stressful. Because the focus of my professional career has always been results-focused, not media-focused. But the recent downtime made me realize that I miss using my PA brain, and I want to create something that has value and purpose to those watching. So blending my medical background with my cycling background seems like a good starting point. My channel will continue to have race recaps once the 2026 season starts, but I will now focus on bridging sport and science with honest and comprehensive education for athletes. You'll see in the coming months I have some exciting topics planned, but today we are going to be talking about concussions. So let's clip in and break it down. Concussions are vague and hard to diagnose. They're incredibly complicated and complex. I want to start by sharing my concussion story because despite my extensive medical knowledge, I still neglected to recognize my own concussion, especially in the first few days. Since I struggled to recognize my own concussion, I hope by sharing my story, you can prevent this for yourself in the future. On August 14th, I was out riding my bike, and as I turned a corner, there was a van driving on the wrong side of the road. This careless driver caused me to crash onto the ground and then proceeded to drive over my bike while I was still under it. At the time, I thought I broke my hip, so I wasn't too concerned about my head. In the ER, I had a head and neck CT scan because I had been complaining of headaches and my helmet was dented. I didn't lose consciousness, and I was never screened for concussion in the ER or given any information on head injuries. The following morning after the crash, I did have a headache, but it was mild, and I had a lot of other pain in other areas, such as my neck, my hip, my rib, and my knee. I remember specifically talking with my coach Dennis at Orange Seal Academy, and I told him I didn't think I had a concussion and my head was totally fine. Looking back, I really missed my concussion in those first few days. Yeah, I had a headache, but I assumed that was from my whiplash injury to my neck. Yeah, I was crying nonstop, but I was nearly killed by a careless driver who I genuinely thought wanted to kill me based on his reactions at the scene. I was also exhausted, dizzy, and very sensitive to light and sound, but I continued to blame all of these symptoms on the trauma and my neck. Prior to getting a formal diagnosis, I did finally start to realize what was going on after what I call the sauna session from hell. The crash happened right after I got back from Leadville, which was a 3-week-long altitude camp to set up the second half of my season. And in typical athlete fashion, I'm mostly worried about losing my fitness and my altitude gains, so I figured I'd start going to the sauna to help maintain some plasma volume. This is when one of the most eye-opening scenarios happened. Within only 3 minutes of the sauna, I had to step out because I instantly got a headache, I was dizzy, nauseous, and I nearly passed out. I had to go sit in a cold shower for a very long time before I could even walk, let alone drive home. You know those showers that have the benches for the elderly? That was me, sitting on one of those just trying not to puke. And that's when I started to realize all of those sudden symptoms at once, this was a concussion, not just my neck, not just the trauma. Eventually I drove home and I was completely a zombie the rest of the day. I napped for hours. The following day, I also slept most of the day and I was so exhausted from this heat and sauna trigger. I called my coach and he talked about how saunas can make concussions worse, and through his experience and my sauna experience, I started to accept what was going on. I had a concussion. I'm not proud that I dismissed my symptoms and failed to recognize what was going on. It's been a learning experience that I think was complicated further by the acute trauma I was dealing with. I just hope that sharing my story can help others avoid the mistakes I made. So let's now shift focus and get into the details of concussions. How do you define a concussion? According to the American Academy of Neurology, a concussion is a form of mild traumatic brain injury resulting from a direct or indirect impact to the head or body. Through research, we know that those impacts just mentioned create shearing forces that disrupt neural membranes, allowing potassium efflux into the extracellular space. This increases calcium and excitatory amino acids, followed by further potassium efflux and a subsequent suppression of neuron activity. As the sodium and potassium pump restores balance, an associated decrease in cerebral blood flow can result in an energy crisis. What the heck did I just say? What I just described is called the neurometabolic cascade of concussion. Think of a thin sac or membrane covering your precious brain. The sac gets these micro tears, which results in pure chaos for the brain. Chemicals and neurotransmitters are going in and out of these tears, and you have unchecked ions and cellular changes, which causes a massive jump in glucose metabolism. In the simplest summary possible, when you get an impact that causes a concussion, your brain is in an energy crisis. Research also shows there is no correlation with level of consciousness to the energy crisis. This means that the energy crisis occurs independently of whether you have loss of consciousness. Too often I hear riders say, "Yeah, I hit my head, but I didn't pass out, so I don't have to worry about concussion." But research shows these complex neurometabolic changes occur in the brain even without the loss of consciousness. Concussions are incredibly difficult to test because they rely on symptoms. They also require a trained professional to appropriately diagnose the condition. There are no readily available scans that actually show a concussion. So not only is the brain incredibly complex, it's also not like a bone where you can take an x-ray and simply know if it's broken. Concussions don't work that way. There are two standardized screening tools that I want to discuss, SCAT and CRT5. I hope that going through these two tools, you can walk away knowing how to best diagnose a concussion, but more importantly, how you can advocate for your own medical provider to appropriately test for concussions. I bring this up because I specifically asked for this testing from my PCP office, and I was told my symptoms were likely from my neck and to, quote, play it safe. I should just stay off screens just in case. This was a huge miss on their end, and thankfully, because I'm a PA and kept advocating for myself, I got in to see a concussion specialist who did the appropriate testing protocols, and this really should be the standard of care. My job is to empower you to know what to ask for and to look for when you're being tested. We as patients are our best advocates in our current healthcare system. So up first is the CRT5. This is the concussion recognition tool, which is designed for the layperson to utilize. Here's what it looks like. Step 1 is knowing when to call an ambulance. Usually people know if you have vision changes or loss of consciousness. Those are red flags. But other ones to think about are neck pain or tenderness. This is really important to get an ER evaluation, but also to get the neck immobilized on the scene. Step 2 is looking for visual cues of a possible concussion. Dent in the helmet, slow or blank stares, or lack of coordination. Step 3 is then asking what symptoms are present, and look how vague some of these may be. Don't feel right, quote, pressure in the head. Ultimately, anyone with suspected concussion really needs to be evaluated by a medical professional, even if symptoms resolve. The next tool is the SCAT, which stands for Sport Concussion Assessment Tool. There's also a SCOTE, which is Sport Concussion Office Assessment Tool, which is similar. SCAT is specifically designed to be used in the first 72 hours and up to 7 days post-concussion. Once you are outside that 7-day window, then it's recommended to use the SCOTE assessment tool, but your medical team should know the difference. One way to know if your doctor is appropriately using these screening tools to test for concussion is how long the testing takes. You cannot correctly perform the SCAT or SCOTE screening in less than 10 or 15 minutes. Let's look at the screening so you have an idea of what the testing and questions should be. I'll show you the SCOTE version since many people have a hard time to get in to see a doctor within 3 to 7 days of injury. It goes through your medical history and family history to start, then dives into symptoms using a rating system that the office can then track at follow-ups. It assesses how impactful those symptoms are and if they get worsened with activity. Then it goes into a series of objective tests, including memory, verbal cognition, vitals, neck exam, and a thorough neurological exam, as well as VOMS testing. VOMS is really important for testing. This stands for Vestibular Ocular Motor Screening, and it is balance, vision, and coordination. Now, I want to go back to the symptom screen from the SCOT and SCAT testing. I think showing this is smart because this is ultimately the best list of concussion symptoms that you can educate yourself on. When I look at this list, aside from the obvious headache, I see a lot of vague symptoms and I see a lot of mood symptoms. Several of these symptoms also overlap with symptoms of acute stress disorder, PTSD, and trauma. And for me, after the crash, I was having nightmares and significant anxiety thinking about all the white vans who wanted to kill me. So I was having many of these symptoms, but I blamed the trauma and stress reaction instead of recognizing they were part of my concussion. I really did not know how to manage or cope with all of these symptoms, especially the emotions you see listed here, and I just felt crazy. I hope as you educate yourself by watching this, you can better recognize what's happening to your brain if you experience this and understand these are normal symptoms to experience with a concussion and they should not be dismissed. Another area to touch on with diagnosing and recognizing concussions is taking time to pause and slow down post-crash to truly check in with yourself. Sometimes it's obvious what's going on, but often I think it's best practice to take 10 or 15 minutes on the side of the trail or road and really just slow down. Let that adrenaline calm down and check in with your body. Often our primary, or what's called the first assessment, is focused on what hurts the most, but we need to do what's called a secondary assessment from the head to toe to see what else is going on. Otherwise, we can miss important injuries such as concussions. Let me tell you a story from back in my ER days. I once had a patient who came in with an open femur fracture. That's an absolutely brutal injury. There's a bone sticking out of their thigh. That's a problem, a really big problem. That injury can actually be life-threatening due to fat emboli, infection, and blood loss. But the point of this story is after stabilizing the femur fracture in the ER, we then are trained in what's called ATLS to do this secondary assessment. Through this, I discovered that the patient also had a fractured shoulder and wrist despite never reporting pain in shoulder or wrist. The patient was only focused on the horrific pain in their leg. So yeah, the point of this story is to show how important that secondary assessment is, and we can implement this habit on ourselves when we crash if we're willing to take the time. Another rule that I'm going to be implementing for myself is after a crash, when I hit my head or any crash that I have neck pain with, I'm automatically going to take 48 to 72 hours of rest. That's not a medical recommendation or research-based. This is just simply through my experience and understanding how easy it is to minimize symptoms of concussion. Another recommendation that I think is well known but not always well respected is replacing your helmet. Helmets are designed to absorb the forces of a single impact, and even if you do not see visible denting, you need to understand that even minor impacts to helmets can compromise their entire structural integrity. So regardless of what your helmet looks like, if you hit your head, get a new helmet. So now you know how to recognize a concussion and how to properly get diagnosed, but the main question we see surrounding concussions is how to approach returning to activity. There are many RTP protocols and charts spelling this out, often a graded or stepwise approach to reintroduce sport competition. The problem with these protocols is there are virtually no recommendations on return to play in endurance sports. I found this incredibly difficult, but ultimately leaned a lot on my coach and my medical team to guide me through this process. The most important thing to do if you have a concussion is to be under the guidance of a sports medicine provider who is experiencing concussions, and they can help you with a personalized return to play. Ideally, a multidisciplinary clinic is best, which is what I utilized down in Fayetteville at UAMS. And for me, this included talking with my coach daily, seeing the concussion doctor weekly, and the physical therapist 3 times a week. They all talk to each other. If you have this approach, your team can identify unique triggers that your sport may have and customize your rehab to those needs. For example, lights were a really big trigger for me, and I was worried about lining up at start lines of events with cameras flashing, so we actually did strobe light drills in PT and eventually got to a point where the triggers were better tolerated. That's the entire point of concussion rehab and PT. You're essentially reproducing symptoms in a controlled environment once you're past the point of making things worse by inducing symptoms. It's a hard line to balance, and that's why I didn't find the RTP charts very helpful in my case. So let's take another step back and ask ourselves, why is there so much emphasis on not returning to competition too early? Well, It's because you want to avoid a repeat concussion, especially before the other one heals. In the research, when you have repeat concussion prior to the initial one healing, this increases immunostaining for gliofibrillarly acidic protein, which is a marker for scarring. This leads to greater cell loss when compared to a single injury. So in summary, repeat head injuries create cell loss in your brain. That's not good. Many of you watching this may already be aware of this due to the media and lawsuits in thousands of high-profile NFL cases. Let's dive into a little history lesson. Back in 2002, Dr. Amalu, who is a forensic neuropathologist, looks at the brains of dead people, he studied the brains of NFL player Mike Webster. In 2005, he published the case study, and this began the era of acknowledging the repeat concussions through what he determined were the hallmark findings of CTE. CTE is chronic traumatic encephalopathy, and it's a degenerative brain disease from repeated head trauma that contact sports can expose athletes to. This degenerative brain disease can present symptoms of memory loss, concentration problems, and attention problems, often occurring years after the exposure. On the flip side of all this scary stuff regarding repeat concussions, the good news is that 85 to 90% of concussions will resolve on their own in 2 to 3 weeks. Many of you watching may have had mild concussions or fall into this category. Let's dive into what the first few days of a concussion may look like. Historically, most recommendations and the social stigma around concussions suggest that if you have a concussion, you are to sit in a dark room without any screens or stimulation. Newer recommendations are now encouraging patients to mobilize early. Generally, it's recommended to have complete rest for 48 to 72 hours. Then you can try to reintroduce ADLs and see how you feel. For those with minor concussions, you can usually follow a basic RTP chart online, but most of these are pretty vague. Let me bring up the CDC's heads-up recommendation that has a 6-step progression. I think this is a good starting place, but again, we will review some more complicated aspects that relate to cycling that ultimately show the need for a medical team to make these decisions with you on a case-by-case basis. Okay, so step 1 is to go back to your regular activities. This is not referring to sports, but rather your ADLs such as school or work or daily tasks that you do outside of training. If you do these and have no symptoms for a full 24 hours afterwards, then you can progress to step 2, which is light aerobic activity. This is generally just 5 to 10 minutes of light walking with keeping your heart rate to no more than 50 to 60% of max. That's not much to work with. When I started walking, I literally had to stop on the hills while I was walking and take breaks. And if you're familiar with Bella Vista, Arkansas, you know what hills I'm talking about. Okay, so after light aerobic activity is then moderate activity and so on. But you can probably already see here that this is pretty non-specific. I think they can work well for athletes in school or organized contact sports, but for endurance athletes, not so much. But it's better than nothing, and for some, this might be a good starting point. I'd also argue that newer research, according to my doctor, is showing that early aerobic activity actually improves symptoms. So in these charts and many other RTP charts, it often says to return to school or work first, then start aerobic activity. But I would argue that after the initial 48 to 72 hours of rest, you want to start the light aerobic activity right away. You might want to walk with someone to make sure you have support if you experience any symptoms, and be aware if you're having balance or vision issues, this could make it worse. So something like a stationary bike might also work. For me, my medical team had me focus on greenway walking, which was level footing and clear views with less visual stimulation. I would not advise walking in the woods or trails, especially if there are things to trip over. You want to be really safe. Treadmills could be a good option too, but for me, the background noise in the gym was too much to tolerate. So that's 85 to 90% of cases. Minor symptoms, and if you're smart and cautious, then over the course of 2 to 3 weeks, you generally have a full recovery. Unfortunately for me, I fell into the 15% category where symptoms did not resolve on their own within 2 to 3 weeks. I actually fall into what is called PCS, or post-concussion syndrome. PCS is when you have symptoms lasting more than 3 months. Symptoms may include persistent headaches, depression, difficulty concentrating, dizziness, imbalance, and fatigue. Risk factors for PCS include prior mental health disorder, prior history of migraines, female gender, and a younger age. Out of these risk factors listed, my gender was my only risk factor, as I have no history of migraines or mental health disorders. For me, my return to sport was very complicated. For my first 5 weeks, I was so exhausted and I was crying daily. I was just trying to do my ADLs without symptoms, which was hard. Most days I would do 10 to 15 minutes of walking or a light 20 minutes on the trainer if it was a good day. And I'll share that I found these light aerobic activities very frustrating because even those tired me out, which was demoralizing when my heart rate was only getting up to 100. It made me even more irritable that I didn't even want to do these. But eventually, I scheduled them into training peaks as aerobic rehab, and I made myself do them because the doctor said it would help. My stepwise progression back into workouts was really guided by my coach after we got clearance to push my heart rate higher than zone 1 by my sports medicine doctor. We started by doing short ramps, only 3 to 5 minutes at most, just to touch into a higher heart rate, but nothing sustained. This was also on the trainer. Then basically we'd monitor symptoms, and it was honestly just a lot of communication with my coach. It's important to know that you can feel okay when you start to exercise again, but you really need to watch the next 24 hours. Feeling fine during the activity is not enough. You need to feel fine the next 24 hours after the activity, and this is really hard for athletes to accept and to listen to their bodies. When I first tried a longer ride, which was 3 hours, it completely wiped me out for the next day, and I had to completely rest, and then symptoms got better. I found this process extremely frustrating because the recovery involved doing things that made my symptoms worse, then resting, then seeing how soon I got back to baseline. It was a constant yo-yo, and despite having experience with other injuries, I learned that concussions are not linear in terms of their rehab, and that was hard for me to accept. 2 weeks prior to Big Sugar, which was just under 2 months after the concussion, I actually tried my first longer workout. I'll put these intervals up on the screen to see. This was the first time I was doing more of a race-paced effort with power variabilities and a really high heart rate. That first interval was about 16 minutes, and I normalized 316 watts, and my heart rate got up to 194. I was actually super excited about this. It felt so good to ride hard and get my heart rate up, especially after 2 months of not really having that. However, afterwards, I got worse symptoms. I went backwards fast with both my neck and concussion after this. So we transitioned into more rest and then eventually made the decision not to try and race Big Sugar because I wasn't ready for group riding stimulus and my brain just wasn't healing. I was going backwards when I tried to get my heart rate up, let alone try to race. I was also still having a lot of panic attacks and mood symptoms, especially with unexpected events such as police sirens or anything that created fear. So my medical team decided it was best not to risk my long-term health by rushing into racing. For me, my performance team for this decision consisted of my sports medicine physician, who I was already seeing weekly, my PT, who I was seeing 2 to 3 times a week, my sports psychologist, and then also my coach, Dennis. It's important to have a strong medical team around you to help you make these decisions, because they are complicated. For me, I went back to my PT the week of Big Sugar, and he did some repeated concussion testing, and my convergence had gone backwards from previous sessions, mostly because we were introducing harder workouts. But having him do that testing helped me accept and understand that my brain was still healing, and I needed to give it more time. I really did not want to have a repeat crash, nor did I want to put my competitors at risk by not being able to be ready to race in a peloton environment. As you can probably observe, it's really hard to guide your own return to sport when you're an endurance athlete and gravel athlete, and even harder when you have a coexisting PTSD and neck injury. I found that using the PCSS scoring system to monitor my symptoms was really helpful. It's a subjective way to track, and I'll put that on the screen, and it lets you know and track how you are doing once you start to reintroduce things back into your life. I would take this scoring system multiple times per week, and I'd write into Training Peaks the numbers so I could see progress, but also see if any activities made me go backwards. It was really helpful. I never saw any literature or doctors recommending this frequent of tracking or monitoring, but I used it as a way to see how I responded to different things and a way to check in with my symptoms, as many of them can be vague and easily dismissed. I also learned that gravel cycling is very unique in terms of returning to sport. What I discovered is that when you ride gravel, you are looking more closely at the ground directly in front of you, scanning for rocks, ruts, etc. Compared to road riding, it's significantly more visually stimulating. Additionally, most gravel roads have trees lining them due to the rural nature of the gravel roads. So with this, you get a lot more light and shadows alternating, all of which can trigger concussion symptoms too. I never once saw this in any return to play recommendation or chart, but it is what I personally felt and observed. The same also applies to mountain biking, but at an even higher scale due to the visual processing required for single track riding. Another area that I want to talk about is autonomic dysregulation. The autonomic system is particularly important for endurance athletes as this regulates our heart rate, breathing, digestion, and ultimately balances the sympathetic and parasympathetic systems. This is an area that is lacking in research, so I'm just going to talk through my personal experiences. I believe this has been overlooked, and based on what I saw in my recovery, may indicate a larger role in guiding return to sport in endurance athletes specifically. I utilize a Whoop. I'm not sponsored by them, I pay full price for this, but my coach likes to see the data, and as an athlete, I have found it helpful to have objective data in my recovery. About a week after my concussion, I started to see really poor recovery and low HRV scores. I'll start off by showing you what a normal month may look like for me. Mostly a balance of green and yellows, generally I get a red score after a race. But the week after my concussion, I had nearly a month without any green scores. This is unheard of for me, and I never have experienced this, regardless of any high volume or high intensity blocks. I was finally cleared to ride outside after about 5 weeks post-concussion, which was mid-September. Now you can see that correlates with starting to see green recovery scores in my Whoop. I think there's something here, a potential correlation with the autonomic system and concussion recovery. So mid-September, I started to ride outside, but then early October is when I started those first longer intervals we talked about. This is a session that caused me to get worse for my neck and my head and ultimately led to my medical team to not clear me for racing. So around this time, I started to prioritize more group stimuli and off-the-bike stimuli for my concussion recovery, and you can see all of this stress caused me to go into another long spell of yellows. I took more time off after this and I focused on my trauma recovery, and then I resumed training for the 2026 season. As I gave myself more time to heal, the green recovery scores have returned, as you can see. I still don't know what my future holds in terms of my autonomic system and the impact here after the concussion. I think it is likely that athletes can use this to help guide the recovery. However, I think it's plausible that some athletes may continue to have autonomic dysregulation and abnormal scores for a long time after the concussion. This may mean that recovery and training looks different even when you're recovered. Definitely something I am learning. For me, knowing this is an area of impact for me, and also knowing how important the autonomic system is for recovery, I started doing more deep breathing and yoga practices to help with this. I also think as my brain healed from the concussion and I worked on my PTSD from being hit, this has also helped regulate my autonomic system better too. The nervous system also plays a large role in mood regulation and emotional state and vice versa. This was a really challenging part of my concussion. For those that know me, I'm a highly task-oriented person. I'm generally focused on logic, not emotions. In fact, if I'm being honest, I usually suppress a lot of emotions and I just opt for the matter-of-fact personality most of the time. But with my concussion, paired with the PTSD, I was experiencing something like nothing before. I was crying literally every day for over a month. My goal some days was just literally don't cry. It was so hard for me to accept. I knew that I had trauma, but I just felt like I couldn't even control the emotions. Sometimes I would just cry and not even know why. I was also very irritable, and my normal coping skills that I had just didn't seem effective. I started working with my sports psychologist right after the crash, and we knew that I was in what's referred to as acute stress reaction. That's basically the early part of PTSD, and we worked really on this at the same time as a concussion, so it was just emotional for me to revisit the scene of the crash because of all the trauma that I had. I would literally get headaches trying to rethink the crash and process things, and ultimately we needed to focus on letting the brain heal first, then doing more trauma therapy after that. Even after 3 months post-crash, I'm still doing trauma work and working to prevent this from impacting my future racing and my career. The research also indicates that pre-existing mental health is one of the most robust predictors of anxiety and mood disorders and prolonged recovery from concussion. Biological sex also has been researched. At baseline, mood and anxiety disorders tend to be more prevalent in females compared to men. So because of this, it's not surprising that females tend to report more emotional symptoms than males both before and after injury. What I did find interesting is that males are more likely to endorse more sadness after a sports-related concussion. I wonder if females are more likely to seek medical treatment for their mood disorders and hence the gender disparity. This has been a long-standing question in the medical field. Data indicates that females tend to be more concerned about their future health and more likely to seek medical care. So in summary, are we seeing worse prolonged and mood symptoms in females because they're the ones getting treatment? Or is there truly a gender difference here? I don't have the answer to that, but it's interesting to think about. Another interesting stat is that 20% of collegiate athletes display an increase in depressive symptoms following concussion as compared to only 5% in a control group. The role of stress really impacts mood in post-concussive studies. I can personally attest to this, and this is something that's made me restructure my life as well as expectations. For me, I'm learning to let go of a lot of things because I don't have the mental capacity to get worked up anymore. I'm focusing on my capacity for training, my advocacy work, and my life outside of racing, such as family and relationships that are important. A lot of this is me being forced to accept my capacity for stress is just different after the concussion. I believe this will continue to improve. For some, it never gets back to baseline, and you have to live life differently. I'm learning that different isn't always necessarily bad, and that the same goals as an athlete may still be achieved, but how you get there may look different. Now, for those of you who follow me on social media, you've probably been aware of me posting about the PTSD and trauma of the crash and subsequent fear of cars wanting to kill me. PTSD and concussions are frequently paired, but there really is lacking research in this area. There is an overlap between these diseases, and it can be hard to differentiate, but it's important that you do because the treatment is very different. I won't get too heavy into the details of PTSD, but I will share that if you did experience trauma with your injury, be kind to yourself and also be aware that you may need more time to let the brain heal before you can really unpack the trauma and do the PTSD work. I was kind of embarrassed about all of this, both with the PTSD and the mood changes I experienced with the concussion, but I think it's worth talking about so that we can work to normalize the mental health impacts of head injuries. I did have a request to look into the research for neurodivergent patients. Didn't find any specific information to this, which was a tad disappointing, but let me make some observations. A neurotypical refers to a person whose brain functions and processes in what society would consider normal, and often these patients do not experience any irregular sensory issues, and generally as a child they met all their developmental milestones. Now, if you are a neurodivergent, this means that you may be different, and often your brain works in ways that others may not expect. That may mean that your communication style is different or your brain processes sensory experiences differently than your peers. Some common neurodivergent examples include ADHD, autism, SPD, or sensory processing disorder. What I did find is that neurodivergent individuals do experience a higher than normal prevalence of mental health disorders. This alone may increase their post-concussion symptoms, and if the individual already has difficulty with processing of sensory details, this will only be heightened further post-concussion. For me, when I sat outside and could hear the cicadas, it was the worst sound. It's like my brain could not process the noise like normal and just have it be background noise. Hearing the cicadas was all I could hear. I couldn't focus on anything else, and it would cause my ears to ring. This is for some neurodivergent patients how they feel at baseline. So then having a concussion on top of that, you can only imagine that would be amplified, and these patients will likely need more desensitization therapy to sound and light. As we have learned, anyone with neck pain post-head injury really needs to have a concussion evaluation, as we learned in the screening tools. There is a very strong correlation between neck injuries and concussion because of the violent forces that are experienced during a concussion that move the brain inside the skull. Often these are rotational injuries, and whiplash is one of the most common ones. I also want to point out that imaging studies do a pretty poor job at showing myofascial injuries to the neck as well as nerve pain. I had a CT scan, a CT angio scan, and an MRI of my neck as well as multiple x-rays. Other than some minor changes, none of these imaging modalities really show the extent of my injury because of my associated nerve complaints. Post-crash, I developed what is called occipital neuralgia. This is when the occipital nerves that run through the scalp are injured and inflamed. It causes headaches that can feel like severe piercing, throbbing, or shock-like pain in the upper neck, back of the head, and behind the ears. Most patients with occipital neuralgia have a history of trauma to the head and neck, with the most common mechanism of injury being whiplash. This occipital neuralgia condition made differentiating my headaches very challenging. It took me literally 2 months to figure out if my headache was from concussion or from occipital neuralgia. Initially, any soft tissue work really flared the nerve pain and sometimes would leave me in bed for an entire day. But over time, I've been able to tolerate specific soft tissue work without those flares, and I believe that's imperative to future management of symptoms. I also found that the research shows fibrotic and thickened trapezius fascia in patients with occipital neuralgia. So I focused more on the trapezius work and modifying my bike position to relax this area to help manage symptoms while riding. I've even found some benefit to yoga because of the focus on elongating and stretching this area, contrary to the position we hold on the bike. So again, I just want to point out that I blamed my neck pain for my headaches, and because of that, I failed to recognize the extent of my concussion. It's also complicated my recovery and made understanding my headaches more challenging. I've also really had to advocate for myself when explaining my headaches to my medical team, as it can be challenging to get providers to understand that the nerve pain in my head was not a normal headache. Okay, so this is a good time to bridge into talking about nutrition and supplements. Now that we know the brain is literally in an energy crisis, I think it's important to talk about carbohydrates. For anyone who has had a concussion, you might relate to the nausea and appetite changes that can occur. For me, I went from training at a high volume and high intensity to virtually doing nothing. I wasn't sleeping, and I had symptoms of nausea and dizziness. I was also concerned about body composition during this time with no training, so I initially transitioned to a high-protein, lower-carb diet to maintain my muscle mass and reduce weight gain. But ultimately, looking back, I think this was a mistake because I did not understand the true energy crisis that occurs in the brain. I think it's really important to not reduce carb intake when you have a concussion, particularly in the early days and in the first 2 to 4 weeks after the impact. It's well documented that the brain's main source of energy is glucose. There was a study done on 40 Division I collegiate athletes, and they found that the athletes that met their appropriate caloric needs and had an increased carbohydrate, they had less symptom duration. It was a small study, but it's indicative of what the pathophysiology also suggests in brain metabolism. So aside from making sure you're getting enough carbohydrates, what supplements are helpful for symptom management and recovery? I'd like to walk through those, but first I want to remind everyone that the best way to get nutrients is through a food-first approach. A well-balanced diet is always the best approach. I believe there is a place for supplementation in certain areas, so I'm going to go through some of the supplements that have more data to support their use. This doesn't mean that there aren't new supplements that may be useful for brain injuries that are currently on the market, but they don't have enough research at this time. The following supplements I will discuss are at least a level 2 strength of evidence based on what's called the Oxford Level of Evidence Criteria from the Oxford Center of Evidence-Based Medicine. That's a mouthful. Basically, if it's a score of 1, this represents the highest level of evidence to support its use. Then levels 4 through 5 at the bottom, for example, have less supportive evidence only from small sample sizes or mechanism-based reasoning. In this research shown here, some of the supplements were downgraded as well if they were only studies in animal species or non-TBI populations, meaning if it wasn't specific to concussions or in humans, it has less evidence to support its recommendation. Creatine is a level 2 recommendation. It's a naturally occurring derivative of 3 amino acids. It's mostly stored in the skeletal muscles, but can also be found in the brain and other organs. Its main function is to maintain an adequate level of energy in tissues that have high and fluctuating energy demands, such as the muscle and the brain. Supplementation has been shown to support cognitive function in healthy individuals following head trauma. In concussions, we've already learned that the brain is in an energy crisis after the injury, so creatine can provide what's called ATP to the brain. From the research I've seen, it could also help manage symptoms, but more specifically has been shown to help cognitive function, headaches, and fatigue. The most interesting fact that I learned while researching was that experimental studies are finding preemptive supplementation with creatine may actually reduce damage following a TBI by 36 to 50%. Basically, that means if you take creatine prior to having a head injury, you may have less damage, which in theory should translate to less symptoms following the concussion. It could also be dose dependent, where higher levels of creatine before the insult may help contain and control neural damage. But this also means on race day, you might consider taking a higher dose. So how much do you take? I personally am taking 5 milligrams per day dosing because that's the most sustainable for me. Some literature suggests 20 milligrams split up 4 times throughout the day, but there's less long-term data on the higher doses, and higher doses are more prone to side effects. More weight gain is also a potential if you are taking higher doses. And I'll admit, I was hesitant to even start creatine because I was nervous about the weight gain. I think that's probably common, more so in females, but after reading more, I realized the benefits far outweighed the risk. Additionally, research has also been shown that males tend to have more weight gain than females. Part of that might be related to the different creatine characteristics in males versus females, with females having 70 to 80% lower endogenous creatine stores compared to males. Endogenous creatine is a creatine that our bodies naturally create versus exogenous creatine, which would be the supplements that we intake. That's pretty wild. But in general, I just wanted to point out that creatine supplementation may be even more beneficial for females suffering from concussion. That's hard to state definitively because of the lack of research on female athletes, but it's certainly plausible. Melatonin is also rated a level 2 recommendation. Melatonin can be very helpful for sleep initiation. That's the phase of sleep where you fall asleep. It doesn't always help with sleep latency, which is staying asleep throughout the night. The study saw benefits with just 2 milligrams of melatonin, but relative to concussions, melatonin is even being explored as a neuroprotective agent due to its anti-inflammatory properties. People underestimate the power of sleep. If you were to ask any provider what their most important recovery tool is, I bet most would say sleep. Sleep can impact immune function, autonomic regulation, and recovery. Sleep can also aid in your recovery of healing the brain. So if you're struggling with sleep as a result of your concussion, you need to make it a high priority to address this with your medical team. Okay, so back to supplements. Next up is branched-chain amino acids, also known as BCAAs or BCAAs. These are level 2 recommendations as well. Everyone knows that protein is made from amino acids. We have 20 amino acids and 9 of those are essential, meaning we cannot make those on our own and we need to get them from our diet. Of those 9, 3 of them are what are called branched-chain amino acids and include leucine, isoleucine, and valine. They play an important role in brain metabolism by acting as nitrogen donors in a number of reactions in our brain. Several animal models have been shown that brain levels of BCAAs are markedly reduced following TBI, and after supplementation with BCAAs, symptoms were reduced with many positive outcomes. Human studies seem to show the severity of TBI correlates with the degree of BCAA suppression, but animal studies did show decreased levels even in mild brain injuries. Supplementation has minimal adverse effects in the literature, so it reinforces the idea that BCAAs may be safe and effective for concussions. With anything that has significant research, there can always be some caveats. With BCAAs, there was question whether it created an imbalance in the uptake of tryptophan, which impacts melatonin production and therefore sleep and circadian rhythm, which is critical to recovery in concussions. I did see some research that was done on veterans with chronic TBIs that high-dose BCAAs actually improved their insomnia. More research is probably needed here, but from my personal experience, I did not experience any worsening sleep when I started taking BCAAs, but it's something to be aware of. Next up, we have Enzogenol, which is a natural pine bark from New Zealand pine trees. Yes, you heard that right. I also had to do a double take when I was reading about this, and I'm still not even sure I'm saying the name right. But this actually has strong antioxidant and anti-inflammatory properties. Studies showed 2 randomized studies that have investigated its use in TBI patients with suggested improved neurocognitive function and physical symptoms. But when I was reading this, I was like, okay, Where do I buy this supplement? I have literally never heard of it. If you Google it, you will see Thorne's Brain Factor or Momentous Longevity or Brain Drive supplements pop up. But if you look at those items, none of the active ingredients have this mysterious pine bark known as Enzogenol listed. So I did some further investigating. The only product I saw being sold in the US is called Pro Health Longevity. And although this product does list a certificate of analysis on their page, I just really can't get on board with recommending this. I also looked at the dose, and it's 250 milligrams per 2 capsules. So if you take the 1 gram per day recommendation for 6 weeks that the research showed, then that would literally be $200 a month in cost for some bark magic. The product is also not NSF certified or Safe Sport certified, so that's an automatic no for me to take. You know what this reminds me of? I once had someone tell me that you can use an aspen tree bark for sunscreen in a pinch. Look it up. It's true. It does provide a low level of sunscreen protection, but can you imagine riding past someone on the side of the road rubbing bark on themselves? I feel like this is where we're at with Enzogenol right now. Maybe in 5 years it might be more readily available, or there's another way to create a bioidentical product. Time will tell, but at this point, even though the article lists it as a level 2 recommendation, I just don't think it's a reasonable option. Ketones are a very hot topic right now, and it could be a video on its own, but for the sake of this video, ketones have not been researched enough in specific concussion populations or in human studies to allow me to recommend them. I will say that out of all of the supplements, aside from creatine, this is probably the number 1 supplement that other people told me I should start taking after my concussion. Anecdotally, I have heard that it can be very helpful for the brain fog and mood symptoms. However, I don't really want to build my channel on anecdotal recommendations. If money was not a concern, I'd be trying them out for myself, but ketones are expensive, especially if you're taking a true ketone ester, not just a ketone alcohol. So that's been a limiting factor to experiment with this. I will just add this as an area that I want to watch for, as I believe there may be benefits based on others' experiences, but there just isn't enough specific evidence here yet. There's one other topic that I briefly want to highlight. You don't see very many people talking about this, but there is something called post-concussion hypopituitarism. What the heck is that? Well, the pituitary gland is in your brain and is basically your master gland. This gland is responsible for hormone production and releases several hormones that then control other endocrine glands in your body, such as thyroid and adrenal glands. During a concussion, it's speculated that there can be micro-injuries to the vasculature of the pituitary gland, which can result in impaired function. The main reason I wanted to educate people on this is because hypopituitarism, yes, it's complicated to diagnose and treat, but it is treatable. Too often I hear of riders or anyone who's had a concussion with persistent concussive symptoms for years after their injuries, and of course this can happen, but I would wager to bet that some of these cases have hormone abnormalities that are not diagnosed. If you can find the hormone deficit and then treat it, those symptoms that you think are related to the post-concussion symptoms may actually improve with hormone replacement. Additionally, most of these hypopituitary cases, they mimic REDS, or energy deficiency in sport, which is a massive performance detriment. There was a retrospective cohort study done on 133 female athletes. No other studies have done specific research on female athletes, so that's cool. But this is why I'm specifically citing this, because females are an underreported population in concussion research. But this study found that 12.2% of females with mild TBI, such as a concussion, they had pituitary dysfunction. That's a pretty large percentage in this specific population. There's a lot that I could discuss on this topic since hormones are incredibly hard to test and manage, so I will summarize by saying that anyone with a history of concussion should be screened for hypopituitary disorders. Generally, there are limited recommendations for how and when, but from the data that I have seen, it's reasonable to screen for this 3 to 6 months after your head injury and 12 months after. If you have prolonged symptoms, then ongoing testing is still something to advocate for. This may involve checking your thyroid labs, cortisol, FSH, LH, estrogen, progesterone, and testosterone. Hormone testing is complicated, so if you want to do this, you need to find a provider who knows how to order and evaluate these labs depending on when they are taken. So this was a lot of information, and the reality is I want you to watch this and have a few takeaways, some of which are new lessons for myself as well. Firstly, I think that any cyclist who hits their head and dents their helmet in any way should automatically take 2 to 3 days off. If you have associated neck pain, I think this is especially important. Always replace your helmet after a crash that involves head impact, regardless of what the helmet looks like. If you have a suspected concussion, seek out an experienced medical provider to do appropriate testing. Don't just rely on symptoms or self-management to return to sport. If you have a concussion, understand that your brain is really in an energy crisis, so it's even more important to properly fuel with carbohydrates and to avoid further deficits that worsen symptoms and delay healing. This can be hard when training halts and the appetite is suppressed from nausea or other concussion symptoms. Talk to your doctor about this, but supplements to consider are creatine, BCAAs, and melatonin. 85 to 90% of concussions will improve on their own in 2 to 3 weeks, but if you do have prolonged symptoms, I recommend getting into a concussion physical therapist at a multidisciplinary clinic to help guide your therapy. If you have an associated neck or whiplash injury, do not delay in treating this or ignore the impact that neck injuries have on head symptoms. They can be very challenging to differentiate. Consider monitoring your HRV, as this may be a helpful tool in monitoring concussion recovery and autonomic dysregulation. Screening for hypopituitarism 3 to 6 months and 12 months post-concussion is probably under-recognized, but I feel important to consider given the overlap in post-concussive symptoms and hormone dysregulation symptoms. So that's my comprehensive review of what's out there for concussions, paired with my personal experience. I would not wish anyone to have a concussion, but ultimately I hope you have found this video helpful. Please subscribe to my channel and comment to let me know how you like it and the new format where I'm bridging sport and science with honest and comprehensive education for athletes.